Hey, this is Ansley Smith, and today I'm going to be performing my respiratory assessment for Nursing 5100 on my volunteer, JJ. For the purpose of this video, she will remain clothed, but I have also done another video prior to this one. So first I'm going to inspect her chest anteriorly and posteriorly, and what you're looking for, I'm going to be assessing for her respiratory rate to make sure that she doesn't use accessory muscles. Notice that the rise and fall is symmetrical. Notice if there's any dips in, which there is none. I'm going to notice for size, shape, and symmetry. I'm going to look both front and back. Everything looks good there. I'm going to look, make sure the clavicles are prominent, make sure that her ribs are prominent. You're looking for barrel chest or a pigeon chest or any deviations, and there are none noted. I'm also going to inspect her mouth and her lips and her fingers. I'm going to be looking for any signs of cyanosis or clubbing, and there are none noted. I'm also going to check and make sure that her chest is expanding bilaterally when she breathes, and it is. The next part of the exam, I'm going to palpate. The expected findings is to everything bilaterally is going to be symmetrical. So I'm going to take the pads of my fingers and I'm just going to feel around. I'm going to make a J pattern. Everything, like I said, should be symmetrical. So I'm just going to palpate. Get you to raise your arm just a little bit. Do the same thing for the other side. Okay, everything's good there. Do the same thing to the back side. Okay, there's no abnormalities, no masses or tenderness found. The next part of the exam, I'm going to check for thoracic expansion. I'm going to do it anterior and posteriorly. Anteriorly, I'm going to have my thumbs meet maybe about the xiphoid process. Take a deep breath. Expansion is bilateral and equal. Do the same thing the back side. Okay, that's good. For the next part of my exam, I'm going to do percussion. I will also make a J area. I will use the index of one finger and strike the opposite index finger of the other finger, the other hand. What you expect to hear over the lung fields are resonance. So you're going to be looking for any dullness or fullness or hyperresonance. Okay, I'm going to do the same thing anteriorly. Okay, everything sounds good there. The last part of my exam, I'm going to auscultate. I'm going to listen to the lung fields. You should hear vesicular sounds, so what you're paying attention to are for any adventitious sounds, such as wheezes or diminished breath sounds or bronchi. Just going to get her to take some deep breaths while I'm listening. You should always perform this bilaterally from side to side so that you can compare sounds. And there are no adventitious sounds heard. This concludes my respiratory assessment.